Welcome to the lecture on Chapter 4, Part 2. So now we were discussing about various social determinants of health and how various theories are used to influence behavior. So now we can look at how can theories be applied in practice. So how to choose a theory or model? So choosing which theory and model to use requires an understanding of public health issue and the population being addressed. There is no set formula of what is appropriate in every situation. So we should look at some guidance in choosing the theory. So Hayden offers following guidance in choosing a theory. That includes identifying the health issue or problem or the population affected, gathering information about the issue, population, or both, identifying possible reasons or causes for the problem, and identifying the level of interaction, maybe intrapersonal, interpersonal, or community under which the reasons or causes most logically fit. And identify the theory or theories that best match the level of interactions and the reasons or causes. Now that's how we choose a theory or model. Now we'll look at how to plan a framework. Looking at how theories can be applied in practice. So there are two approaches that can be undertaken to apply theory into practice. One is social marketing and the other one is proceed framework. So coming into social marketing, it is the use and extension of traditional product marketing. So its campaigns are successfully being used in developing world for promoting a range of products such as family planning and pediatric rehydration therapy. In recent years, the social marketing efforts have been used in developed countries, including such efforts such as Tooth Campaign, National Youth Anti-Drug Campaign, or the Verb Campaign. So the Tooth Campaign aims to direct the perception of smoking being seen as a teenage rebellion against the alleged behavior controlling tobacco industry. The National Youth Anti-Drug Campaign uses social marketing efforts, including the parents against the drug or anti-drug campaign. The Verb Campaign, it focuses on tweens or 9 to 13-year-olds with the goal of making exercise fun and cool for everyone, not just competitive athletes. So there are four main P's which is incorporated in social marketing, which is the product, price, place, and promotion. Product is identifying the behavior or innovation that is being marketed. Price, identifying the benefits, the barriers, and the financial cost. Place, identifying the target audiences and how to reach them. Promotion, organizing a campaign or a program to reach the target audiences. So the C, social marketing, like the product marketing, often relies on what marketers call branding. So branding includes words and symbols that help the target audience identify with the service. However, it goes deeper than just words and symbols. So it can be seen as a method of implementing the fourth P, or promotion. So branding requires a clear understanding of the product or the behavior to be changed. Successful branding puts forth strategies for reducing the financial and psychological costs. And branding identifies the audience and segments of the audience and asks how each segment can be reached. So branding is the face of social marketing. Now let's look at the proceed planning framework. This framework provides a structure to design and evaluate health education and health promotion programs through a diagnostic planning process, followed by an implementation and evaluation process. So there are about 9 steps of the framework, which are divided into 2 phases, the precede and the proceed. So looking at the diagnostic phase, that is called the precede, You have to do social assessment, epidemiological assessment, behavioral and environmental assessment, educational and organizational assessment, administrative and policy assessment to identify what needs to be done. So let's look at an example of gun violence in social assessment. In social assessment, we are asking the people's perception of their own need and quality of life through data collection activities such as surveys, interviews, focus groups, and observation. Looking at gun violence, it emerged as a major concern among community members through focus groups. Moving on to the next assessment, that is the epidemiological assessment. It determines which health problems are most important for which groups in the community. It is often by analyzing data from vital statistics, national surveys, etc. These steps are helpful to identify the subpopulation at higher risk and provides data to set measurable objectives. Again, coming on to this example of gun violence, so data from death certificates and crime reports reveal that majority of deaths among males younger than 24 years are due to gunshot wounds. Next, moving on to the behavioral and environmental assessment. So now we look at identifying the risk factors, internal and external to the individual, that contribute to the health issue of interest. We do literature researches and theory application, provide guidance during this step. Again, literature search provides insight into factors contributing to gun violence among males younger than 24 years. So gang-related behavior is found to be frequent in population with similar socioeconomic status that of the target population. Next assessment is education and organizational assessment. So preceding and reinforcing factors that initiate and sustain behavior change are identified, such as individuals' knowledge, skills, attitude, social support, peer influence, and availability of services. Here, interventions are aimed at males aged 16 years and younger are found to be more successful. Young males with older male role models are more likely to view gangs as negative and more likely to participate in sports and community service. Next is administrative and policy assessment. So identify policies, resources, and circumstances that may help or hinder implementation of the intervention. Here, the communication system recently established between school system and law enforcement to report trends in criminal behavior amongst the student population is an example of administrative and policy assessment. So it may assist in identifying subgroups to target the intervention. Next is the implementation or the evaluation phase, that's the proceed. So first is it includes implementation, process evaluation, impact evaluation, and outcome evaluation. So first is implementation. Here the intervention is implemented. So after school program implemented that incorporates educational, service-oriented, and physical activity components led by males from the community. And the program is tailored for males 12 to 16 years of age. So that is a program that was implemented to reduce this violence. Okay. Next is process evaluation. In process evaluation, we assess the extent to which the intervention was implemented as planned. Further, we evaluate how the program activities were delivered. That is the process. So it assesses the extent to which the intervention was implemented and how these program activities were delivered. That is the process evaluation. Now we will look at the impact. In impact evaluation, we assess the change in the factors identified in steps 3 and 4. That is by behavioral and environmental assessment and educational and organizational assessment. So we assess the change in the factors identified by behavioral and environmental assessment and educational and organizational assessment. So one example is we evaluate the gang associations among participants in the after-school programming. How is that? Is there any reduction in gang association among participants? Next is the outcome evaluation. So our outcome will be assessing the effect of the intervention on the health issue of interest. So evaluate deaths due to gun violence in the community before and after the interventions. So that is how proceed framework can be implemented for a public health issue. Lastly, we will end this chapter by looking at a newer field. It's known as behavioral economics, which seeks to utilize new understanding about human behavior to change behavior of clinicians and patients. So one understanding is that losses loom larger than gains, which means that when there's a potential loss, the participants feel the need to change the behavior to gain a reward or to gain the lost money. So just-in-time reminders work well. If there is a desirable behavior and the reminders are given just before that, the behavior is encouraged. Or maybe for example, adherence to medication, you have a reminder to take the medication, you might take the medications better. Or default choices are usually retained. So a clinician, for taking an example of clinicians, a generic drug may be more chosen over a brand drug if that is being the default choice, kept as a default choice. And then we are more influenced by colleagues and peers than by evidence. So if looking at the prescribing practices of more colleagues, so information on colleagues' prescribing practices has been shown to have a greater impact on changing physicians' prescribing behavior than evidence of effectiveness. Then creating new habits is key to behavioral change. So apps which provide reminders to take medication, exercise, or do other routine behavior may be useful for developing and reinforcing new behaviors. So these new understanding from behavioral sciences is likely to continue to improve our ability to change behavior in ways that improve outcomes. Thank you.